I'm Dr. Donna Barsky from Ask Dr. Donna. I'm going to show you a few products. I know in my podcast I talked about lung health. I'm going to show you some of the products that you'll use in that lung health to kind of help you breathe a little better. Now I know that a lot of times doctors will say, well, go get a peak flow meter, or you need a nebulizer, or you need a spirometer. Most cases when you have lung issues, you need to be able to find out what kind of lung capacity that you have. A lot of times your body will tell you that you're fixing to have a problem before you're unable to breathe, or before you're having breathing problems, or the fact that your scratchy throat is there and you know that something's wrong but you're not really sure how bad it is, or that you've had a trigger hit you and you're not really sure if you need to take your metered dose inhaler or not, which is your short-acting medication. I want to show you some of the products that we're talking about. In most cases, when you have constant lung problems, the doctor's going to say, go pick up a peak flow meter. Well, there's a couple of brands that I have and I keep in stock all the time. This first type is the Asthma Check. Asthma Check is a very easy one. If you'll notice, it's got the markings on here. You will have 3 different zones. On the zones, you're going to have the green zone, the yellow zone, and the red zone. Now, when you use these, we want you to be in an upright position. You take the red marker and you bring it all the way down. You have your green zone that's up here, your cautionary zone, which is yellow zone there, and then your red zone, which is the danger zone. You're going to be having issues. When you're using this, you're going to exhale all of your air. You're standing in an upright position. You clamp your mouth on the mouthpiece and you blow as hard and as fast as you can. This red line will come up as far as you go. Your doctor will have set these 2 lines for you already. He knows what kind of lung capacity you're supposed to have. What we want you to do is use this every day. Start in the morning before you've used your medication. Let's see what kind of lung capacity you have first thing in the morning. Now, the doctor will reset your green zone where you need it. Now, when he resets the green zone, that means that's your safety zone, and that's your personal best. So the yellow zone, we're going to have to watch it. Maybe you're having some issues. But when you get to where you're down in the red zone, the doctor's going, you know what? You need to start using your short-acting inhalers. The short-acting inhalers are our rescue inhalers. We try not to use those more than a couple of times a week. This is going to tell you whether you need to use it or not. This is a different style. This one right here is the Access one. It's a little larger. Sometimes it's easier to read. But it has, there again, the green zone, the yellow zone, and the red zone. This has 2 different mouthpieces. Remember, when you are blowing as hard and as fast as you can on this, that's after you've exhaled all of your air. Inhale as much as you can, and then you're going to blow as hard as you can. This is down. When you blow, this is going to set this wherever your lung capacity is. That's what tells you if you're having issues or not. That's how we use a peak flow meter. We'll put this back down. I'm going to show you what we talk about with a spirometer. A spirometer is a product that helps you exercise your lungs so that you learn how to control some of your lung capacity. Even when you're having the constriction or whatever, if you've got better lung capacity, sometimes that helps you through that issue. A spirometer looks like this. Now in a spirometer, if you'll notice, there's a ball in the back. So as you are blowing in this, what you're trying to do is raise this ball halfway and keep it there. A slow, continual blow is what we're looking for. When we can do that, then you have exercised your lungs for better control. Nebulizers. What do the doctors mean when they're talking about a nebulizer? This is maybe something you maybe need a nebulizer treatment 3 or 4 times a day, or when you're having issues to get you through those bad periods of time when you have a lot of triggers, then they'll put you on a nebulizer, and there's several different types. This type right here is a portable. It's one that you can actually plug into the car if you're on a trip. It comes with a battery that recharges it. That way you don't have to rely on cords or electricity if it's already been charged. Then I've got some really cute ones that we use for kids. We've got the little penguins, which are great for kiddos. I've got one that's a racer car. Now we don't sticker those, we allow the kids to do it. That way when they want to decorate their car, they can decorate it with their own number. They can put on their own pinstripes, they can put their wheels on. anything that they want to put on that car that can decorate it for them. If it helps them learn to trust the machine, that's what we want them to do. Use that machine. Use the nebulizer. We have tubing. Now this is tubing. This is a cup. Let me pull this out of here so that you can see what I'm talking about. In most cases, all kits come with a medication cup. You know, there will probably be a tube connection on the bottom. This is where you put your tube from your nebulizer to the cup. And then when this opens, you put your medication inside the cup, you screw this back on, and the top, you're either going to apply a mouthpiece, because we'll have a T-bar here, and this mouthpiece will fit here. So you're either going to be using a mouthpiece, or you're going to pull this off and use a mask for a child. Now we happen to have a little dragon mask here. Some of the little kids really like this, but you can use the dragon mask on this. They'll leave it on, they can be doing other things while they're allowing their medication to be inhaled. Now when you're using a nebulizer, we want them to breathe deep. Hold it for a couple of seconds and keep repeating it until all of the medication has been bubbled out of this cup. That's what we call a treatment. It usually takes 10 to 15 minutes and it's over. For those individuals who are using rescue inhalers and they have difficulty learning how to use them, in most rescue inhalers, you always take them, shake them before you use them, pull the lid, exhale your air, and as you're inhaling, you take your spray. If it says 2 puffs, you do it 1 puff at a time. So as you're breathing, hold 10 seconds, then release. If it's 2 puffs, after you've done the first puff that way, then you do the second puff the same way. Now, for those patients who can't get this timing right, and there are a lot of them that are. There are adults who can't do this, there are children who can't do this, there are older individuals who can't do this. We have what they call a chamber. In the chamber, it works the same way, except you don't have to have great timing. You shake this up, you push it into the end, and then you pull the cap, you get ready to go. You put your mouth and clamp it down on the mouthpiece. You spray your puff in there and you breathe it in. You do not have to do it at the same time, but you breathe it into the lungs, deep into the lungs as far as you can. Hold it for 10 seconds. Then if you have another puff that you have to take, you spray it again, breathe it down into the lungs, hold it for 10 seconds, and then you're done. That explains a chamber, but that's what a chamber does. It allows you to get all of the medication that you need without having to have perfect timing. Now, for any of you who have questions, what I do want you to do is pick up the phone. Call Texas Star Pharmacy. If you have problems with your medication, if you're not really sure how to use one, we're going to talk about some long-acting products. Now, I don't have any out here, but Advair is one that is used a lot, and that's for patients who are using long-acting products that are actually going to be used over a long period of time to keep the inflammation down in the lungs. When you use a discus, you do not have to shake it. But when you open it, there is a click that you have to involve. Now, when you do that, this disc, and it looks like a disc, is held sideways this direction, not this direction. You clamp your mouth on it and you breathe in, hold it for 10 seconds, move your mouth away from it, breathe out, and then you put it back on and breathe in again. I always want my patients to use 2 breaths. There's powder in a capsule that actually is going to be pulled down into the lungs. We want to make sure that you get all of it. That's why we want you to breathe it twice. There again, if you have any questions, give us a call. We've got staff members here who can help walk you through this, teach you how to use your medication. You'll have better outcomes and hopefully a much, much better quality of life. This is Dr. Donna Barsky, Texas Star Pharmacy. Ask Dr. Donna and come in and see me.